Welcome to our instructional video on how to order dried blood spot testing in the Vibrant portal. Dried blood spot, or sometimes also referred to as finger prick testing, is a new feature that Vibrant has launched in order to help to come up with resources for practices who are struggling to find phlebotomy solutions during this time. This resource will continue to be available even after the COVID-19 pandemic and some of the shutdowns and quarantines restrictions lift. So don't worry, it's not going to go away. The way to order is basically exactly like ordering regular phlebotomy that you're probably already used to. So what we'll do is we'll just walk through this on a patient that already exists, but just know that the process of ordering dried blood spot collection method would be the same through this process as it would if you were creating a new patient. So let's go to a patient that already exists, and once their information populates, we'll verify that this is in fact the patient that we want to order on. All their information should be pre-filled, or again, if you're ordering on a new patient, you're going to pre-fill that information. And essentially what you're going to do, if you have seen our marketing information or spoken with your local rep, you will know that our Vibrant Wellness menu is available to be ordered. All of the blood-based tests on there are available to be ordered via dried blood spot. And each of the tests that has this capability, you will see this little icon next to them that lets you know that this can be dried blood spot. So if you are trying to order a test, for instance, on our Vibrant America menu and you don't see that icon, it's because that is not yet validated for that test. So it's going to be the entire Vibrant Wellness menu. The one exception is total immunoglobulins. We are not yet able to run this one with the same level of high sensitivity and specificity yet on that platform. So as we work to continue to bring that up to our standards of quality for you, that one is still going to have to be drawn on traditional phlebotomy if you're wanting to order that. Okay, so let's say that we want to order a wheat zoomer and a total tox burden and perhaps fungal antibodies. All right, so we have a combination of blood-based tests as well as some urine tests. What you'll do, scrolling down here, is you'll notice there's now some different information that you'll notice under the required tubes. The first thing is send dried blood spot kit to patient. This is if you are not going to be collecting the sample in your practice, or the patient is remote to you, or the patient cannot come into your practice to pick up a kit, or for you to, be there present with them in order to collect the blood. This is the easiest method, and typically this is what most practices are going to want to select, just because it's less work for the patient in terms of them coming in multiple times to your practice. So let's say, yes, that is what we want to do. We want to have the kit drop shipped to the patient. Keep in mind that the urine-based tests and stool-based tests are already automatically getting drop shipped to the patients. So in this case, it would make sense that you would also want to have your dried blood spot kit shipped to the patient as well. You've selected tests that require non-blood. These do get shipped to your patients, right? This is just letting you know, FYI, those are going to get shipped anyway. That's your urine kit for your total tox burden. This is going to let you know that dried blood spot is going to ship to the patient address provided. It's really important that you make sure that the patient information up here is correct when entering it, because that is where the lab kits are going to go. It's going to let you know that there's going to be 2 finger prick cards required, and then 1 extra, or if you are drawing it, 1 extra EDTA tube required for what you've ordered. But the 2 finger prick cards, you don't need to remember this. This will automatically get sent, which cards they need. That's just letting you know that they should receive 2. There is additional information that you can view as far as phlebotomy and which tubes, if you are going to draw blood. Just know that that's available. Then you're going to select your payment information. So again, if, however you're set up for payment, You're going to walk through the rest of the order process is exactly the same as ordering regular labs for a patient. You're just going to make sure you have your payment information selected. You're going to, if everything looks correct up here, you're going to go ahead and complete the order, and everything is handled for you at that point. You can still go and share the requisition. You can download the full requisition, only the order information or the specimen information. This will download the collection instructions, which explains urine collection for any of the urine-based tests, because you've ordered a urine test here, exactly what to do with that. And then it also gives example of how to collect dried blood spot. So what you would want to do if you are not ordering dried blood spot for a patient is, instead of selecting ship dried blood spot kit to patient, you would want to leave that box unchecked. So let's do this again. Let's say we're just going to do a wheat zoomer this time. If we leave this unchecked, a kit will not go out to the patient. And what we will expect then is to receive the appropriate tube from you, as far as the blood that's required to run for a test. And that's it. Again, the process is pretty straightforward. It's essentially the same as ordering regular phlebotomy. You're just going to specify whether or not you want to have a dried blood spot kit sent to your patient. And then you can share collection information and the order information with them, as well as the fact that that information comes with the kit for their order.